Good morning, it's Adam Green and the Breakfast Team with you, 7:37. Now, as you may have heard already on the show this morning on BBC Radio Shropshire, hubs are springing up across the county as a place for the county's Ukrainian refugees to go to for support and friendship. Local authorities and the NHS in Shropshire have also put information online, and Ukrainians are being encouraged to register with local doctors' surgeries. Well, one Shropshire GP who found it understandably difficult to witness what's happening in Ukraine is Dr. Victoria Gabinet, who is Ukrainian herself, and she's with me on the breakfast show this morning. Victoria, good morning.
Good morning, Adam. Good morning.
Thank you very much for taking the time to talk to us this morning. It must be, and I can't even put myself in your position, it must be incredibly shocking watching what is unfolding in Ukraine.
Oh, thank you ever so much for having me and allowing me to sort of say my side of the story, and it's absolutely devastating. From the beginning, we were in disbelief, but now, it's 2 months, and it's really difficult to comprehend or explain all the situation. It's 21st century, and who would even imagine that this war would happen? Or it's truly barbaric invasion, and the only question we all ask, why? There is no justification to this killing of innocent people who just worked and lived to feel free, independent, and prosperous. So it's really, really hard for everyone, for my family back home, many friends. Really, really hard to accept this or explain, indeed.
Where are your family in Ukraine?
So I've got my mom, and my husband is Ukrainian too, so all his family back home as well, but they more towards the west, so they do have very frequent sirens, but the infrastructure more or less safe at this point. But of course there are no safe places in Ukraine for sure.
No, of course. Have you been able to help them in any way and communicate with them?
Yes, of course. We communicate every day. We've tried to send collections here, and I have to say that I'm so grateful to everyone around here. They opened their huge hearts to help Ukrainian people, and especially to Shropshire community, to Telford community, to Polish community in UK, to my surgery where I work at South Hermitage, and the Teldoc, it's a big surgery in Telford. People were absolutely incredible to collect things, and that was the transport organized to send things which are so helpful to everyone back home. And of course, I have to say that we are grateful to UK's government as well. Despite all the criticism, all Ukrainians are immensely grateful for its truly substantial help and never-ending kindness. And I think, Adam, what's the most important, that they stand in with Ukraine and in this difficult time. And I think this is just truly priceless.
The NHS in Shropshire and Telford and Wrekin have created a dedicated online area. What kind of information is there on it?
Okay, so and it's very important to sort of spread this information to people coming from Ukraine, but also to people who open their hearts to have families in their houses. So please, everyone, welcome to general practice. What they need to remember, that they don't need to have ID or fixed address or immigration status. We encourage all refugees to book an appointment with a doctor as soon as they can, so they can have the initial consultation with the doctor if some medications will need to be reissued, or some tests needs to be done, or provide support on current ongoing medical needs. It's all important to do straight away as they hear. It just helps to avoid any health emergency. And actually, if there is any health emergency, it can be addressed in a timely, effective, and safe manner then.
It's so important, isn't it, to register with local GPs? I understand there are some myths surrounding what you need to see a GP. What are you hearing? What are those myths?
So the information from CCG, and I'm grateful to Alice Lomas, Tom Brattle, and the team behind it. So what they need to remember, that it would be the best that they see GP as a face-to-face, so we can go through, because what you have to remember, there is a language barrier as well. So it's difficult over the phone, of course, but if they can bring any information they have about their past medical history, about their medication, so that we can go through one by one and prescribe that, and it will be all in the system. And if anything needs to be done, it will be so much easier then. So yes, please, we need to make sure that these families, they come for face-to-face to see GP, and then we can go through all the records.
Have you had the chance to meet any Ukrainian refugees, Victoria? And if you have, what's the feeling that you're getting from them?
So I'm aware of a number of families coming to Shropshire, and actually to different parts of Shropshire. We have 3 families registered with my surgery, South Hermitage Surgery. Unfortunately, I haven't had a chance to meet with them yet because they registered just last week. But of course, I'm looking forward to that. And I think it's even difficult to imagine what they've been through, leaving their houses, homes, families, older generation, they not very keen